Hi, welcome to our channel. My name is Jeongcheol Park. I'm a periodontist and I'm going to explain a very innovative and very powerful treatment concept called Zurich-Style implant, which can finish your implant treatment in just 2 visits. First, surgery. Second, the final crown. It sounds amazing, right? I'm going to explain what is Zurich implant style. If you Google up, you cannot find that name because I just named it. It's a very new concept, but it has a very good advantage for your lifestyle. I know that you're watching from this overseas, from far away from Korea, and you have a chance to visit Korea, but you have a very short-term stay, but you want the implant. And as you know, the implants take a very long time, sometimes 2 months, sometimes 3 months, and you cannot stay and wait until the implant is over, right? So while you're staying like 1 week or 2 weeks, if you can finish the implant in that just period, wouldn't it be amazing? This Zurich-style implant can do that for you. So where does this concept come from? The University of Zurich is a very innovative and key opinion leading dental college and study group, and they have reported this concept. So I just named that implant the Zurich implant style based on their studies. What they did was they placed the implants, and then on the same day they take the impression to make the crown. When the patient comes back for the suture removal after 7 days or 1 week or 10 days, they deliver the porcelain final crown on the second visit. So total visit number is only 2. It's an innovative, earth-breaking, shaking concept, but it has a very strict condition. So everybody cannot receive the Zurich implants, but if you fit in to this category, this will be a perfect choice option for you if you do not have enough stay here in Korea. How does it go? I'm going to show the procedure. On your first visit, ideally you should have a missing tooth or you have a failing or ailing tooth. So we do the extraction on the first day, and immediately after the extraction we are going to place the implants. And then we usually wait 2 or 3 months before the impression taking, but in Zurich implant, we take the direct impression on the same day after the surgery. And you can go home. After 7 or 10 days later, when you come back, we are going to remove the suture, and then we prepare the final crown and connect it. And that's it. Only 2 visits, your implant is over. But we need very important criteria to deliver this kind of a concept to you. First, the Zurich study group reported it is recommended to the single implant of the posterior molar region. Why not on the front teeth? When you deliver the implants right after the extraction or the surgery, the gum level does not stay there. They usually go a little bit downward during the healing period. So if you take the impression on the same day gum level, it will look fine a couple of days or weeks. But after a month later, your gum level will change and the margin, the edge of the crown, will be visible later. For the front teeth, it is not a beautiful sight. So we don't recommend it to the front teeth, but we recommend it to the posterior regions, which is not quite easy to see that margin. So it is recommended for the molar area, and you should have a sufficient quality and quantity of the very hard bone. Because we are going to place the implants and also we are going to connect the final crown, your implant should be as much stable as possible. So it should be really, really strong bone. If you do not have it, this concept can be a little bit difficult to apply to you. And when the patient have a very wrong, very powerful, very aggressive grinding or clenching or irregular alignment of the tooth, this concept cannot be recommended. So we recommend relatively stable occlusion patient is a good choice. And of course, this is really important. We need your cooperation. We deliver the crown and we recommend wait just 2 months. Do not use it. If you want to use it, eat it with like bread or rice or very soft food. But if you eat very hard food, if you use a lot of force during the eating, the implants will be mobile and sometimes they fall out. So for the 2-month healing period, we need your cooperation. Everybody says that, oh, I won't use it. But immediately after, when they go home, they start using it and they become much more courageous and they eat harder and harder and harder food. Eventually, they fail. So we don't want that to happen. We want your best cooperation. If you understand the limitation and shortcomings of this concept, then if you agree, we can do that for you. And finally, you should do a good oral condition. This applies to any implant. So you should keep a very good oral condition to maintain a good implant health. I'm going to show you 2 cases. I know that it is very difficult to imagine what's going on with the Zurich implant. So I'm going to show you how it is done with the real pictures and real x-rays. The patient came from the Canada and he's staying here in Korea only 1 month. He has 2 problems. One teeth on the upper right, it is a periodontally compromised, so I treated to make a healthier tooth. On the upper left molar, it is already gone. So we need an implant, but he's staying only 1 month. So it's a very short. We cannot finish that with a regular old classic treatment concept, but Zurich implant can help you with that. So this is a situation. It is a missing molar teeth. Luckily, he has a very good physics. So he's a good physics, healthy bone, healthy gum. So extracted area looks good to place the implant. So on the first visit, we placed the implant with a good primary stability. And then on the same day, we took the impression. We used to take a very, I know it's a little bit gagging reflex can happen type impression, but nowadays we use a digital scanner. It's just like a digital camera. We take a lot of pictures and then that's it. You can go home. This is the right after the implant placement, and this is a digitally scanned image while you are resting at home or maybe having a little tour inside Korea. We are making the crown for you. After 10 days, when you come back, we remove the suture and then we connect the final porcelain crown. That's it. Of course, you cannot eat and use that with that. At this time, at least 2 months, your crown and your implant should rest until the bony healing is complete. So that's why you should eat on the other side. And with that tooth, maybe the rice, maybe the potatoes, and maybe some vegetables can be eaten. But if you eat harder food than that, it is very risky. So you should keep that in mind. Number case 2. This is a Korean patient living in Australia, and he had a friend who talked about this Zurich implant concept. So he had a missing teeth, so he wanted to place the implants while he was staying very short here in Korea, 1 month. So we did our best to treat as fast as possible. So this is a missing area. Luckily, he had a good bone, very long and good quantity. So day 1, we placed the implant with a very strong bone stability. And then, this is the right after the surgery, we took the digital scan, and this is a digitally scanned image. In this case, he had a good bone and he had a good gum, so we didn't even lift off the gum. We made a very small hole to place implants. So minimally invasive surgery was done. So maybe 5 or 10 minutes, that's it. Implant was placed, scanning, and then you can go home. And then 10 days later, we prepared the final porcelain crown we connect it. And this is a final situation. Beautiful, white, new crown has been delivered, but not yet. You cannot use that, okay? You can use it, maybe bread, maybe rice, but harder food, above that, you cannot use that. Up to 2 months, now you can use it as a natural tooth. This is a Zurich-style implant concept. Only 2 visits. Everything is done. Zurich implants, as I mentioned before, require very careful post-operative care. So if you agree and if you show your good cooperation, then we can do the Zurich-style implant very easily. After implant and the crown connection, at least 2 months, you should wait until we have a good bone healing, which is called osseointegration. Soft food is recommended. Very soup, rice, tofu, maybe chopped beef, that's it. If you eat harder than that, there's a very good risk. And if you have a habit of grinding or clenching while you sleep, we make a night guard for you to keep your implant crown stay away from the occlusion and clenching. So if you need, please let us know. We will make a night guard for you to protect the Zurich-style implant. So this Zurich implant style is a very innovative and very new concept which can be very limitedly applied to certain patients visiting Korea a very short period. But if you perfectly fit into this category and if you show your best cooperation, we will do our best to deliver your new implants as soon as possible with Zurich implant style concept. If you have any questions, please leave a comment below this video, or we have a WhatsApp account so you can just type it in and ask us anything. There will be a little bit delay, but we will do our best to reply as fast as possible. So study this video, study this concept, and when you visit Korea, please give us an email or give us a call. Okay? Thank you for watching this video.